Hi, my name is John Arthur. I'm the director of the Englewood Public Library, and I'm here with Danielle Lambert and Yael Yankelowitz from Englewood Health, our local hospital. And we are going to do a recorded version of an anxiety management presentation that we did a few days ago so that it can be accessible to everyone once we post it. So without further ado, I'll have Danielle and Yael go through their presentation. Thank you.
Okay. Hi, everyone. My name is Danielle, and my colleague and I, Yael, are going to give you a brief presentation on anxiety management during these times. I want to thank John from the Englewood Library for having us. He reached out to us about collaborating on a way to get us together and kind of discuss what's going on emotionally with us and how we're all dealing with this. So our presentation, it's called In This Together. We want to spend some time just talking about some practical advice about anxiety and go from there. So let's get started. So the objectives for our conversation is first and foremost to connect with each other. It can feel very isolating right now. Many of us are at home or asked to sort of separate themselves from our normal social gatherings. So we want to connect with each other, check in, see how we're doing. Next, we want to define and normalize anxiety, kind of normalize what we all may be feeling both physically and emotionally right now, and then discuss some practical tools for coping with stress and anxiety. And at the end, we want to hear from you, hear what your thoughts are if you have any questions. We look forward to speaking with you. Okay, so this first slide, I spent some time watching the news on social media, looking at articles, and these are all the words that kind of were thrown at me. So if you look at some of them, we have lockdown, uncertainty, uncharted, unprecedented is a big word I'm hearing right now. And all these words sort of incite anxiety, at least for me. And so it matters what information we're taking in each day, then this is sort of what we've all been thrown into. So we're going to talk a little bit about the basics of anxiety and then offer some tools for you. So I'm going to pass it to my colleague, Yael. So go ahead.
Hi, everybody. All right, so we wanted to discuss what is anxiety. So anxiety is an emotion. Anxiety is usually a reaction to something going on around you. Anxiety is different for every single person. Different people manage anxiety differently. Some people have an easier time managing anxiety than others, but at a time like this, where things feel different than usual, many, or if not most people, are having a more difficult time managing that anxiety. Just like every other emotion, the emotion of anxiety is the body's natural response to something in the environment. And in this case, anxiety is the body's natural response to stress. It is often intense worry thoughts and fears about everyday situations, both the present and the future. And your anxiety is going to be different than the person sitting next to you or anybody else for that matter. And their anxiety is going to be different than, the person sitting next to them or anybody else. Anxiety is often exacerbated by fear of the unknown or a feeling of lack of control. When we don't know what the future holds, when we don't know how to change things, when we don't know how to manage our situation or whatever it is that's going on in our environment, it becomes much more intense and much more frequent. You can't feel as though you have a plan of action because we don't know what's going on. At the same time, this doesn't mean that you can't manage that anxiety, and it also doesn't mean that it's not normal. It is absolutely normal, it is valid, and it makes sense that you may be feeling that way. Like I mentioned, every single person's anxiety may be different. So on the next slide, you'll see some common symptoms of anxiety. These are not all of the symptoms of anxiety, and surprisingly enough, the symptoms may be different in different age groups. So if you look at something from the symptoms of adults, it may be different than teenagers, adolescents. And that actually is often different than children. So if you look right here, we'll see the symptoms of anxiety for adults may be feeling nervous, restless, or tense, having an increased heart rate, breathing rapidly, sweating, trembling, feeling weak or tired, having trouble sleeping, experiencing GI problems, and having difficulty controlling the worry. That worry may be spinning around your head and it may be hard to think about anything else. If you look at the next slide, you'll see the common symptoms of anxiety for teenagers. It's often inability to control feelings of worry and stress, restlessness or edginess, fatigue, difficulty concentrating, irritability, muscle tension, and having trouble sleeping. And on the next one, you'll see children, which is constant thoughts and fears about safety, clingy behavior with parents, inability to concentrate, irritability, trouble sleeping, inability to relax, rapid heart rate, quick breathing or difficulty catching one's breath, stomach aches, and headaches. Now, why is it important to understand what the symptoms of anxiety might be? So one of the reasons it's really helpful to understand is if you understand what you're feeling, if you understand, hey, the emotion that I'm feeling right now is anxiety, it becomes just an emotion. It doesn't become this big, dark, scary hole. It's an emotion that can be managed. It becomes much less scary when you're able to label it. When you say, what symptoms am I feeling? And you recognize that emotion, you can, kind of decrease the intensity and decrease the frequency of that emotion. It's also very helpful to understand the different age groups because you can recognize, maybe your child is feeling anxiety and you wouldn't even have noticed because it's not the same as yours as an adult. Same thing with a teenager. Teenagers are often very different than little kids, and you don't always know what they're thinking or feeling. So recognizing some of these symptoms can be very helpful as well. Regulating your emotions is much more, manageable and easy to do if you actually understand what you're feeling in that moment.
Okay, so we're going to discuss some options for you to be taking care of your overall health right now. First is physical health. Most of us, for the weather is getting nicer outside, and if you have the opportunity to go for a walk or step outside for a minute, that's really important for your physical health. And being out in nature can also, lower your levels of stress. So we do recommend that. A lot of people use yoga and mindfulness as a way to relax. There's online exercise classes right now. Many gyms and programs are offering free classes via the web, so that's something to check out. Put dance on here. Music is important. If dance is your outlet, try and listen to music or, dance with the people at home you have there. And most importantly, we have sleep. It's important to make sure we're keeping a regular schedule for our sleep, going to bed at the same time, waking up around the same time. That'll help you both physically and emotionally to kind of work through each day. And emotional health. First and foremost, take a break. I know some people are working from home. Some people are still going into work. And for example, we have staff at the hospital. And it's important to make sure you're taking a break throughout the day. Even if it's 5 or 10 minutes to make a phone call, go for a walk, get some water or tea, just make sure you're taking care of yourself. Other ways people relax, some people like to read, some people like to meditate, some people listen to music. We'll talk about breathing exercises and staying connected. When I say stay connected, I mean reaching out to a family member on the phone, doing FaceTime or video conferencing to kind of touch base with everyone and stay connected with your family and friends and neighbors. Often when we talk about coping skills in the field, that's a term we use in the behavioral health field, it really is like coping skills are more about habits that you already have or you enjoy that help you feel safe and help you feel grounded. So whatever it is that works for you, there might be other options that we don't have on this list. Make sure you're doing them and make sure you're taking the time for yourself. For nutritional health, we want to make sure you're drinking plenty of water. Just stay hydrated, both for your, physically. If you're working throughout the day, you want to make sure you're drinking enough water. As far as eating, many of us, when we're stressed, some of us can overeat, some of us can undereat and not eat enough. So you want to be aware of what you're eating each day. Make sure you're cooking healthy meals together, and make sure you're all kind of checking in on each other at home and making sure you're eating healthy. Okay.
Hi, so Danielle just mentioned quite a few skills and coping mechanisms that can be very helpful. And she mentioned the word mindfulness. Now, we hear this word mindfulness all the time. You hear it when we're talking about yoga and meditation and things like that. But the question is, what is mindfulness? So mindfulness is about staying in the moment and noticing your thoughts and emotions, not judging your thoughts, not judging your emotions, and definitely not judging the judging, because it will happen that, you'll be distracted by other things, other thoughts will come in, and that's okay. You just have to refocus your attention, again, in order to stay in the moment. Just notice that you're having another thought, let it slide away, and refocus on whatever it is that you're trying to focus on. Focus on the facts. Remember, thoughts are not facts. We often get stuck in our head. We believe that thoughts are facts. We believe that we know what's going to happen without a question. But in reality, focus on the facts. And if you can focus on the facts, you can recognize that the anxiety level is very high, but certain things may not happen in the future that you think are going to happen, for example. And that will help you reduce that anxiety as well. Like I said, sometimes we get stuck in our heads. So it's often very difficult to apply the coping mechanisms. Even if you think, oh, it's so simple, like going to get a tea, it's often difficult to remember to do that in the moment. And it's also very, very difficult to focus in the moment. So if you're wrapped in these worry thoughts and racing thoughts, and you're trying to go to sleep and something is bothering you, it will be hard to use mindfulness techniques when your head is just not focusing. So if you practice these mindfulness exercises on a regular basis, it can sharpen your mind. It can, it's almost like lifting weights. It's almost like you're strengthening your muscles. So you're doing mindfulness on a regular basis when you're feeling good, so that the muscle is strengthened and you'll be able to use it more easily when you are feeling overwhelmed and when it's more difficult to think things through. One great exercise that's very helpful and can actually be used, it's one of the reasons it's very helpful is because it can be used anywhere at any time. You can be grocery shopping, you can be at home, it doesn't matter where you are. You can pause, it doesn't take a long period of time, but you can do some deep breathing. Just remember, deep breathing does not necessarily make you feel better right away. You have to practice, you have to take some time. It's not going to be like taking 2 deep breaths and then feeling better. You have to give yourself a chance and practice a little more. So as it's written here, there are 2 breathing exercises, both pretty easy to remember. The first one is very simple deep breathing. You're focusing on inhaling a long deep breath very slowly through your nose, filling your chest and then filling your belly with all of that fresh air. And then when you're letting it out really, really slowly, blowing very, very gently, and exhaling longer than the inhale. This is often helpful when you're feeling that rapid breathing or you feel as though you're not getting enough air. It can just fill your body and fill your belly with fresh air. You can also tweak it and you can try to mindfully breathe in the positive and gently exhale the negative. That can be helpful as well. Again, there are so many ways to do deep breathing exercises. You can find a ton of deep breathing exercises online that you can have guided exercises. If you just look on YouTube, it's very easy to find. The second one that's here is square breathing, focusing on your breathing. Instead of just breathing in that long, deep breath, you're counting. So you can count to 4 while you're breathing in, hold it for a count of 4, and then gently exhale to a count of 4. Once again, if you're having that rapid breathing, the trouble breathing, it's very helpful. It's also helpful because you're focusing on numbers. And when you focus on a number, it can get you away from the thoughts, can get you away from the worry thoughts. Deep breathing is also really important because it's not just a skill that you can use to calm your mind, but it actually physically calms your body. And when your body is calmer, when that muscle tension decreases, when you feel more relaxed, and your body is calm, then your mind will feel calmer as well.
Okay. So I created another word cloud here with some language that I've been hearing, but it hasn't been, I wouldn't say it's been as loud. We hear people talking about coming together, healing, staying connected. So I thought, what if this was the language if we all kind of worked towards and tried to spread throughout our community? It's just something to think about. Some of these concepts we talked about today, but I've seen a lot of great examples of people working together as a community. And it's just something to keep in mind that we're all in this together and working together to help each other. So let's see. So since this is we're re-recording this session, we had a lot of great questions and discussions with the community. I don't know if maybe John, if you want to ask us some questions, if you remember what we discussed, and then we'll kind of go from there.
Yeah, there was a pretty good discussion about, I think, what's centered on mostly being connected to what's happening in the world via news, social media, but at the same time knowing when to step away from that and not be constantly engaging with those things. So how do you think people can kind of navigate that?
Right. Yeah, we discussed the news, and I think the challenge in this day and age is that the news is available 24/7 and in different formats for all of us. We had a couple options. One, I remember, I think I said as little as possible. If you can check the news, you want to, if like in the morning you want to get your directions, you want to make sure you're following what government officials are saying. But at the same time, it can be overwhelming if you are kind of exposed to that information all day long. And then I think Yael mentioned you could even set a schedule. For example, I'm going to check the news in the morning once for 15-20 minutes, and then in the evening for 15-20 minutes, and then kind of leave it at that.
Right. And the time in between is not, you're not missing anything new during those few hours in between, and remembering that there are other things to think about and other things to focus on as well. And I also mentioned making sure that you receive your news from reliable sources.
Yeah,
as a librarian, I second that one definitely. So,
good.
Also, we had a fair amount of participants that are themselves working in healthcare. So could you speak a little bit about how healthcare workers who are, overburdened at this time can actually take care of themselves so that they can continue to be able to take care of other people?
Yeah, we had spoken about taking breaks and just taking some time for yourself, stepping away for a few moments. And another thing that I know I had mentioned was getting support from your colleagues, getting support from the other people who are going through it with you, who are in your office, a supervisor, or even just someone who sits at the desk next to yours, taking that step away and just talking to them about your stress and, seeing how they're feeling and things like that, that may be helpful for you.
Okay. So I think that is all we have for today. Unless Danielle or Yael have any closing remarks.
Well, I do want to share some resources on the next slide.
That's right.
Yeah. So we listed some emotional health resources from credible websites. We have the CDC that has some self-care options. The next one is SAMHSA, it's Substance Abuse and Mental Health. It's the national organization. Just some tips on how to manage your stress during social distancing during this time. The Virus Anxiety website offers different mindfulness activities and coping skills that may be helpful. And then we listed our website as well if you want to look at our services. I do want to also mention another resource. We have the NJ Hope Line, which is our statewide peer support and suicide prevention phone number. It's they're available 24/7. I also listed the National Suicide Prevention Lifeline and the Second Floor Youth Helpline, which is for young adults and teens. Just a reminder, if you or anyone else is in distress, pick up the phone and talk to someone. That's the most important thing. And so we wanted to make sure people know that these resources are available 24/7, just, to keep that in mind if you need any assistance.
Okay.
Anything else? Or
I think that may be it, Yael.
Yeah, just in general, Danielle was just saying about reaching out. I think people should remember also that it's not a bad thing to reach out. It's not as though you're not functioning and, you can't manage on your own. Support systems are just really, really important. And that's one of the things that can get you through a lot. So don't be embarrassed to reach out. Don't think that people will think negatively of you. If anything, if you reach out, you're the one who has the courage to, say, I need help. And I think that's really important to recognize.
I
Okay.
agree.
Yeah, it's always true, but now maybe more than ever, at least lately.
Yeah.
So thank you so much. Please, everyone, check out what the hospital's doing, what Englewood Health's doing. Check out englewoodlibrary.org. We have a lot of programs so that we can stay connected. And hopefully we can do some similar programs together soon. So stay tuned for that. All right. Thank you very much.
Thank you.
Thank
Take care,
you.
everyone.